just to kind of go over my key messages and my number one goals. And number one is to protect the health and lives of Oklahomans. Number two is to keep our businesses open safely. And number three, to keep our schools open safely and educate our children. And that is a non-negotiable for me as well. All three of those are things that we have to learn how to balance. We've got to learn how to do that together. We've got to learn how to do that safely. And you can't look at one without thinking about the other two. So we're in constant contact with our health professionals, with our hospitals across the state. I know Vice President Pence, I was with him yesterday in D.C., and he's doing a press conference right now. Cases are going up all over the country. All governors are juggling with how to flatten the curve, and I'm proud of Oklahomans. They're doing a good job, but it's certainly something that we need to keep our foot on the gas, so to speak, and make sure that we do our part coming into the holidays and the winter. And as we've seen our cases tick up in the state of Oklahoma, it's certainly our desire and the health department's desire to continue to remind Oklahomans all the things that we've been talking about for the last 6 months. And so, but the Vice President also wanted me to let Oklahomans know that help is on the way. He feels like that we will have 60 to 7 million vaccines distributed by the end of this year. And so Moderna has 20 million, Pfizer has 50 million, and he wanted me to let Oklahomans know that. And so we're prioritizing those and figuring out how to get that out quickly in the state of Oklahoma. So with that, I'll open it up. We've got Dr. Fry here, who's our secretary, who's over our health department, and we've got Lieutenant Colonel Matt Stacy.
Governor, what other tools do you have in your toolbox? And you've said repeatedly you're not going to mandate statewide masks. What else can you do? Both mayors in Tulsa and Oklahoma City were having press conferences today. Pretty alarmed at what's going on.
You know, we obviously work with the CDC and the recommendations from the health department. We took some measures earlier this week that we think are going to make a difference. We looked at some analytics about what we could do in the state of Oklahoma. The two things that jumped out were bars and restaurants. We moved the needle more than anything. And so that was something that we did, as you know, early in the week on Monday. And we worked with the Restaurant Association and limiting their, spreading their tables apart, and also asking them to close down. We've got their buy-in and support for bars and restaurants at 11 p.m. So it doesn't happen overnight. It'll take 2 weeks to see that kind of come through. And again, when you think about this curve that we're all trying to flatten, we had 3,000 cases today, I believe, and yesterday was 2,900. The day before was 1,500, and then for 4.5 months, June, July, August, we were pretty flat, and we just saw this tick up. We're seeing it tick up in Wisconsin and Illinois and all these other states, and so everybody's trying to remind people it's about social distancing, it's about spreading out, staying home, following the CDC guidelines on quarantining when you're exposed to others. So those are all the things we're reminding people. So I think we've gotten a little lax for the past 6 months, and we have to remind people to help us out here and continue to flatten that curve. So that's our goal.
What else do you have in your toolbox, though? Anything else you have under consideration?
There's if we see them continue to go up, and when we're watching the hospitalizations and their capacity, the next lever would be elective surgeries. If you remember, when we issued our our executive order at the end of March, and we limited elective surgeries, what happened was we had 600 healthcare workers laid off in Tulsa, and we got 1,000 laid off in Oklahoma City. We created a lot of capacity. But that's certainly not what we want. So instead, and Matt Stacy can talk to you about that, we've instead encouraged the hospitals to create a surgical reduction plan, every single hospital. And so our first step would be to ask them to start implementing that surgical hospital plan. The other thing that you've got to remember is, ask the hospitals. Most hospitals are working, and they always operate at 95 to 100% capacity. That's where they're normally operating. Most businesses always want to be at 100% capacity. So it's really not unusual to be at 95 to 100% capacity. So what we're really watching is we have 1,300 folks in the hospital right now being treated for COVID in acute hospitals. And so we don't want that to continue to rise and take up more and more capacity.
There is a point out there to where surgeries are going to have to be, elective surgeries or non-essential surgeries are going to have to be stopped. You know, how quickly we get there or when we get there, I don't know, but there is a threshold, and they know that better than I do. And so I really need them to tell me when we're getting there, when they need that help. And they're in agreement with that, they understand that, and I know the governor has already drafted an executive order and is ready to use that whenever it's necessary.
And let me just point out one other thing there. It's a really tough situation. When we limit elective surgeries, that makes the blood pressure of every physician go up. And Dr. Julie Watson expressed it very well in one of the last press conferences. If you remember, an elective surgery is only elective if it's not yours. And there's mammograms that went undetected. There's heart procedures that didn't get performed that led to other deaths. I take that very seriously, limiting that. We want the hospitals to do that. We want the health professionals to do that. And so that is something that we take very, very seriously. And we're really working with the hospitals to institute their own selective surgery reduction to keep that capacity. Remember, we have 1,300 people across the state, about 5,600 hospital beds. We're also encouraging their surge plans to create more capacity. It's stuff that we looked at early on, versus picking and choosing and telling what's an elective surgery and what's not.
I didn't talk to that doctor specifically, but I did talk to someone from the region, and again, I think part of that was they said they didn't have enough ventilators and things, and we have those, and we have them in our stockpile. I mean, they just need to go to OKRMRS, I believe is the website, okrmrs.com, and go on and click and find out who the regional RMRS director is, and request what supplies they need, and we can help them with that. Staffing can be an issue. We understand that, and unfortunately, doctors are difficult to find, but we've been working on other ideas like pooled staffing for nurses, etc., in regions with hospitals working together, and that's been helpful. One thing that the hospitals asked for that we did through executive order was setting up the RMRS, which is a transport kind of air traffic control, transferring patients around the state. We reduced insurance requirements from 72 hours down to 24 hours, which really helped step down and getting patients out into kind of a long-term care facility. Really cleared some red tape for nurses, licensing nurses from out of state, so that's also in place. Also, talking to the nursing board, making sure that nursing students can come in and help, because staffing, to his point, can be a problem, and so that's something that we're all over right now to make sure that we have what we need to take care of the patients we have.
Governor, can I ask you a little bit about education?
Sure.
You issued a targeted mask mandate earlier this week to state employees and state facilities. The State Board of Education has heard calls for a mask mandate for all state schools. Is that something similar that you might support, or would you oppose that for all state schools?
Well, first off, I had a few schools call me and text. We heard some rumors or some rumblings that they thought that I was wanting to shut down schools until January 1st. If that was misunderstood, that was a total misunderstanding. Basically, I think around 93% of our schools are in person right now in some format in the state of Oklahoma, our school districts. And it breaks my heart on those 7% of schools that aren't open in person. And so I am setting a goal and a vision for all 100% of our schools to be in person after the Christmas break. I certainly want schools to be safe from now till then and want them to continue to be open. Again, like I said in my opening comments, educating our young people is a non-negotiable to me.
But on the mask mandate for schools
Yeah,
across.
so that's to me a local school decision, and so I support those local school districts that have done it. I think most of our schools are requiring a mask at some level for them to be in person. We're also working with the CDC and some guidance. If I have a mask on and I'm in school, then the quarantine rules are different. And those are things that I want to support and promote that we've talked about with the school districts. That if you wear a mask and I'm in a classroom with another student that came down positive, does that help with the quarantine rules if I get a negative test? So that's the other things we're working on, and that's some of my trip to DC, talking to the testing experts and Vice President Pence. There's some things that are going to come out just shortly that'll be reducing from a 14-day quarantine to potentially 5 or 8. Because one of the problems I think nationally that these numbers are going up is people are not quarantined like they should. They're not staying the 14 days. But if you get a negative test after 5 days or 8 days, I think the compliance goes way up. Because at the end of the day, this is about compliance, getting people to do the right thing, getting people to socially distance, stay home when they're sick, wear a mask when they're around others, wash their hands frequently. It's not about magic words. It's really about compliance and getting Americans, Oklahomans to pay attention and flatten that curve as much as possible.
I've got two follow-ups real quick. I'm sorry. You've had the ability to appoint a couple members to the State Board of Education. Are you, since you're not in favor of a state mask mandate, have you communicated that to them, or if they felt like it was appropriate, would they have the freedom to make that decision themselves, or do you want them to follow your lead on that?
You know, we want, obviously we try to put the best people in every board position. My Secretary of Education, Ryan Walters, he talks to probably folks across all the different boards that he manages, just like any other secretary. So don't know exactly what the conversations are between them, but we certainly want our appointees to think the way we do and to encourage all the things that we're talking about. So I would assume they would be right in line with where my beliefs are.
And just lastly, I'm sorry on the topic, you mentioned that you would think it's more of a local control issue on the whether a school has a mask mandate for students and teachers, et cetera, et cetera. You said earlier when you walked in that your third goal was to have all schools open. How do you square that? If it's a local control issue on whether to have a mask mandate at a school district, is it not also a local control issue for that school district to determine, okay, we're going to stay online?
It's a great point. And while Oklahomans are hopefully watching me right now, we need to get involved in your local school boards. You need to run for, if you don't like what's going on in your local school board, you need to get involved. Because what's happening is 90% of these parents are calling our office, and there's polls, and there's over 90% of the parents want their kids in person schools. And so I'm just encouraging them to get involved with their local school district. We can't lose another year. I mean, number one, the CDC has never recommended school closures. They do not recommend school closures. The risks far outweigh the rewards of kids not being in school. Some of the stats that I have my team look up that I think are critical. Mental health. This is something that needs to be reported on. The CDC says mental health emergency room visits for kids are up 24% for ages 5 to 11. Mental health, 31%. The mental health visits to emergency rooms are up 31% for kids aged 12 to 17. Suicides have doubled for adults. 25% of people 18 to 24 reported considering suicides. The Brown University study, 47 states. There was 200,000 students in this study, 63,000 staffs, so all across the country. They said infection rates of students were 0.13% and staff was 0.24%, far lower than the general population. So schools aren't the super spreaders. It's more of the community. That's why we're encouraging. That's why we're here talking to you, and I appreciate the media and you guys getting this message out to Oklahomans because it's really about it's really about compliance and making sure that people are taking it serious all over the state of Oklahoma. And that's all of our goals. And so I need you to help me get that message out because we don't want to see it go from 3,000 a day to 4,000 a day. We want to see it start ticking that down, and I believe it is by us talking about it and by us all reporting together and encouraging and bringing the science out.
Governor, we know your stats on statewide mask mandates, but have you given any consideration to regional mask mandates? Oklahoma City Mayor today, David Holt, said that he prefer maybe a regional basis because there's some municipalities like there's in Tulsa County that do not and have not voted on a mask mandate. Have you thought about doing that on a regional basis or on a statewide basis?
You know, again, I mean, I'll say it for 100th time, and I've been saying it the whole time. Wear a mask. Y'all need to print that instead of always asking me about the magic word, right? Over 50% of our state is under a mask mandate because we believe in the local control, so the municipalities. But if magic words were the answer, Minnesota, for example, they have 50% more cases per capita than Oklahoma, and they have had a mandate in place for 121 days now. Illinois is 17%, they have 17 more cases per capita than we do. Chicago is totally shut down, no in-person dining, and that's been going on since May 1st.
What's the harm at this point, though, for a mandate? What's the harm?
Well, number one, I believe I believe it's unenforceable, and I believe that the government shouldn't be that. I don't believe in a one-size-fits-all approach to
The White House has recommended it multiple times in the last reports.
I'm sorry?
The White House has recommended it multiple times.
No, I don't think so. When Deborah Birx was here in the state of Oklahoma, she recognized that really it's about compliance. And when these states acted too early, what you're seeing is, what you really need to ask is why are the cases in Illinois going up when they've been shut down since May 1st? So Oklahoma we've been fully reopened for 6 months. And so we're seeing our cases go up, not as fast as some of these shutdown states. It's a virus. And if I could wave my magic wand and get it to totally disappear in Oklahoma, I would do it. But again, I don't think it's about magic words. I think it's about compliance and social distancing and those kind of things, and washing our hands, staying home, making sure you do stay home when you've been exposed or if you've been around someone that's positive. And I just believe that right now, people all across the country are so fatigued with it that they're not compliant. And that's why in Oklahoma, by us coming back and really getting on the same message with the news and with the media, we can make a difference. But if we try to divide each other, I don't think that's doing anybody any good.
So this Saturday is Bedlam, and you want people to take it seriously, stay home. There's going to be a lot of people there, a lot of Oklahomans gathering in one college town. What's your response to that, and are you moving?
Well, I didn't say stay home. Did you say stay home?
Stay home and not put yourself in a normal situation.
Yeah, I said we have to be smart. We need to social distance, those kind of things. Be safe. Wear a mask when you're around others and you can't social distance. But again, and I've said this since March. This is a virus that could be with us for a while, and I think it's important that we have our kids in school. I don't think it's just like in March when people were pushing me to bunker in place and to have a total shutdown. We did things differently, and we have to live our lives. We've got to educate our kids. This could still be with us in January. I am so hopeful that the vaccine.
Are you going to Bedlam?
Am I going to Bedlam?
Yeah.
I'm planning on going to Bedlam, yes. Are you going to Bedlam?
I'm a Longhorn.
You're a Longhorn. All right.
Governor, I have two for you. First being, today the mayor of Oklahoma City and Tulsa asked their residents to take a 10-day pause from any high-risk activities, seeing anybody. Always that includes Thanksgiving. Would you make a similar recommendation statewide, or what would you tell people statewide? I know I've asked them.
You know, I'm going to be with my family over Thanksgiving. I'm going to do it safely. I'm going to be with my parents. I think Oklahomans should be with their loved ones over Thanksgiving. Let's be safe about it. We talked about our kids coming home from college, make sure that they're tested before they get with grandparents. And it's a great idea. If you have elderly grandparents, people that are immune compromised, keep them distant from the young people. So that's some things that we're talking about over Thanksgiving, and I can let Dr. Fry give us his thoughts there. But yeah, we have to do it safely, but we know people are going to be gathering with their families over Thanksgiving, and we can do that safely.